Listener, this is Radio Parcis, 90.9 FM, Peace of Christ for all. My name is Harry. We are 10 minutes after 7 p.m. It's a Tuesday, and that is the 20th of October 2020. And of course, we've been telling you that from 7 to 8, we'll have guests from a Center for Health, Human Rights and Development, CEHUD. And of course, we'll be talking about maternal health services in Arua. And later on, yes, we shall have your questions, comments, and contributions on 0776 255086 or 0754-201301. You can also send in your messages on the SMS line. That's 0393-273252. And with me, I have Antereko Ibrahim, who is the Program Manager, Strategic Litigation, Center for Health, Human Rights and Development. Yes, Tereko, you're most welcome.
Thank you, and we are grateful to the listeners of Parcis.
Okay, yes, thank you very much. With me, I have Namaganda Jen Chibira, who is the Program Officer. Yes, Namaganda, you're most welcome.
Thank you. Good evening, viewers.
Okay, thank you very much. With me, I have Edith Sifuna, who is also the Program Officer. Yes, Edith, you're most welcome.
Thank you.
Okay, thank you very much. And to begin with, yes, let me have Edith to tell us about the background of this organization and what it does.
Thank you very much. Good evening, our listeners. We are happy to be with you, and we hope to have fruitful deliberations through this talk and this sharing and discussion. So I'm tasked to introduce what CEHUD is, or CEHUD. So CEHUD is the Center for Health, Human Rights and Development, and it's a research and advocacy organization with emphasis on health and human rights. CEHUD is located in Kampala, Gayaza, and that's where we are found, and that's where our offices are. However, CEHUD works with different programs, and these are classified in 4. One of the programs that we work with is the program in campaigns, partnerships and networks. That's where I work as a program officer. And this program is mainly focused on policy analysis that impacts on health and human rights at the national level, where we engage different policymakers and duty bearers to come up with policies and guidelines that to realize the right to health. And then we have another program, which is strategic litigation, which is headed by Mr. Antereko Ibrahim. And this program is mainly focused on legal aid, providing pro bono services to victims of violation of health and human rights. But we also litigate cases, and one of the cases is one that we are going to talk about during this show. Then another program that we work with is knowledge management. This one is mainly focused on research, monitoring and evaluation, fundraising, documentation, but also capacity building. Then our last program is community empowerment, and this program focuses on empowering communities to engage duty bearers, but also make them accountable. And under this program, we work with community structures. We call them community health advocates. These are people that are found within the communities. They are the link between the communities and CEHUD. They identify health rights violations, and then they also engage duty bearers to make sure that services are available at the health centers, at the districts. They engage in budgeting processes, and they have a lot of work that they do as our community health advocates. Right now we are in West Nile, or Arua, and the Greater West Nile region, and someone may ask, where is CEHUD working in West Nile? CEHUD is having engagements here in West Nile under the DINU project, where we look at empowering communities, of course, through our community health advocates. We empower them in issues of governance, accountability, but also policy analysis. And this involves working with the duty bearers at the community level, sub-county level, and the district. And through this work, we are working with partners, like Partners in Community Transformation, or PICOT, that is found in Koboko, but also working throughout West Nile. Yeah, majorly SEHAD is focused on sexual reproductive health and rights, where we look at the rights of women, adolescents, but also other vulnerable populations within the communities. Yeah, so briefly that is SEHAD.
Okay, yes, thank you very much, Edith, for taking us through the background of this organization called SEHAD. And listener, we are 16 minutes after 7 p.m. and if you've just tuned in, this is a Radio Parcis, 90.9 FM, a piece of class for all. And of course, we are talking about maternal health services in Arua. And later on, yes, we shall have your questions, comments, and the contributions on the studio lines 0776 255086 or 0754-201301. You can also send in your messages on 0393-273252. And of course, let me get to Serenko. Yes, we are talking about maternal health services in Arua. Yes, what do we mean when we say maternal health services?
Thank you, the host, and I also thank the listeners of Parcis. Maternal health is largely part of the general health, which is a complete state of physical and mental health, and this even has social aspects, including food, including sanitation and water, and all those other components that inform the broader health as a right. But when it comes to maternal health, we also look again at the physical and mental issues and social issues surrounding the delivery, the attendance of antenatal, issues to do with consumption, issues to do with family planning. All those are broader aspects of maternal health. So to be able to, for a woman to enjoy this right or maternal health services, we need to have availability of maternal health services, which I've tried to break down, which may be in terms of pre-conception information, antenatal care, postnatal care, safe delivery, family planning, and so many other components that form that package of maternal health. And these services are supposed to be available to all the mothers, irrespective of their status in society. Whether you are poor, whether you are rich, whether you are from a particular tribe, you are supposed to access maternal health services in the public health facilities. Beyond the availability of this service, it has to be within physical reach of people. So we need to ensure that whoever is responsible, the duty bearer at the top, we have the Ministry of Health, we have the local governments, and now the city. They're supposed to ensure that the services are within the physical reach of women within that particular region, but also in the country at large. And these services have to be accessible in terms of, again, the distance, in terms of the fees. If we are aware that the government abolished payment of user fees in all public facilities, but even if you have a public wing, say in the regional referral hospital in Arua, the fees should be affordable. We should have subsidized fees. You don't have to charge fees that are equivalent to fees charged in a purely private facility. So the services should be affordable, but also there's a component of information. Our mothers are supposed to have information on maternal health care. How do you prepare for the pregnancy? What do you require when you go for antenatal? These issues of health information, health education, they become core components when it comes to maternal health, because many of our mothers die because of the famous 3 delays. Some of them delay at home because they don't know what to do. They don't know the signs of pregnancy. If they are given adequate and accurate information on those aspects, I think we can be able to prevent and avert some of those preventable deaths that are experienced on a daily in our country and in our region. So beyond that, the services must be acceptable. We work within cultures. We have different cultures in West Nile. We have different beliefs. We have different religions. The services of maternal health should be acceptable. For instance, if in a particular community the mothers prefer to deliver when they are squatting, we need to find a way of accommodating them within our health system. So the health system has to be compatible with the beliefs of people. They have to go within, they have to work within their acceptable medical ethics. So all those are components that form what we need, what we can call general as maternal services. But also the aspect of quality is very key. The services should be quality services. If you have a health worker or midwife handling a mother, are they qualified to provide that service, or someone is just learning on job? So So we expect someone who's providing the service to be professional, to be accredited by a particular regulatory body. Do they have a license from, say, if they are doctors, do they have a license from the Uganda Medical and Dental Practitioners Council? If they are nurses, they have a license from the Nurses and Midwives Council, and do they renew the licenses? So the aspects of quality are very key. They also extend to the drugs that we use in the facility when we are working on these mothers, and all the aspects that deal with the quality of care, which they are also very key when we talk about maternal health. So maternal health is just a spectrum of so many things that ensure that our mothers safely go through delivery and after delivery.
And what is the judgment on maternal health for the people of West Nile?
Thank you so much. I think as an institution and as a country, I think we need to treasure the people of West Nile because they came up to stand with us to ensure that we can rehabilitate many of our mothers that were dying needlessly in many of our public facilities. This case is essentially premised and surrounding around two mothers that died in Arua Regional Referral Hospital and another facility in Mitiana, which is in central Uganda. But specifically for Arua Regional Referral, we have a woman who was empowered. She was a district councillor who you think should be empowered to be able to demand and claim for better services. She was referred from Health Center 3, and I think is currently now under Terego. She was previously under Arua. That mother was referred in a very good in a condition which could be managed at Arua Regional Referral Hospital. The mother came on time. The husband was always there. But the challenge is that this mother died because of basic services that were not available at the facility. For instance, it is expected that the facility should have mama kits. These are basic things that are supposed to be available for any mother who walks into a public facility. So there are no mama kits. We didn't have doctors who were readily available to assist this woman because she suffered an obstruction which required an emergency operation. The doctor was not available to conduct that operation. Despite the cries of the husband, and the woman bled to death, and it's one of the traumatizing situations for the husband, but also for the mother. It's unlike other conditions where you progressively die, but you work within a facility and you save one place which you think you'll go out safely, and then you die while bleeding. You bleed to death while you are seeing that situation, while you are yearning for help, while dying in agony. So it is a very, very serious and terrible situation for any person to die in. And it is terrible for our mothers and sisters to die in such traumatizing situations. So this mother died in such circumstances, and we thought it's very important for us to work with the husband of the deceased wife to ensure that we can be able to not to penalize the facility and not penalize the health workers they are in, but we wanted to challenge the structural challenges, the system challenges in the health sector, because this situation was not unique to Arua. It is a situation that is happening all over Uganda. We have done quite a number of cases and documented a number of cases where women walk into facilities, public facilities, where they're supposed to receive free services, but they end up incurring a lot of expenditures which are not gazetted anywhere, and they end up even losing their lives. And because of basic services, absence of an ambulance to take her to a referral facility, absence of gloves, absence of surgical blades, such things which could be purchased and they have to be readily available in the facility. So this death was not unique in Arua, but it is something that is happening on a daily in many of our parts of the country. So we said, how do we create change? How do we create system change? And that's one of the reasons why we are motivated, and the family of the late Anguko Jennifer, who died in Arua Regional Referral Hospital, to pursue this matter, not to target the health workers, but to target the system. Because if you don't have a good system, then you don't have mothers enjoy their right to give birth to us. So we took on this matter in the Constitutional Court, and our questions were also basic. We're asking for a court to determine if a mother walks into a facility and they don't find basic maternal health commodities, they don't find a doctor to be able to attend to them, if they don't find a nurse who's supposed to monitor them, advise them how they're supposed to handle the pregnancy, those basic things, emergency obstetric care, presence of a theatre, functional theatre at a health center 4 level. So you find that many of our facilities are at a level like a health center 4, which is supposed to have a functional theatre, but they just have a structure which has a theatre, but the theatre is not functional. And you find that those that have functional theatres, the health workers are not there to operate the mothers. And those that have mothers, there is limited supervision. You find a health worker who is supposed to be on duty, they are in another part of the country, and so many mothers have lost lives in such circumstances. So we went to court to have those questions addressed, but also to give a place of the right health and right to maternal health in our constitution. So in this journey, we encountered so many hurdles. Because the justices of the Constitutional Court looked at this matter as a political issue. They're asking, how can you question, how can a father who has lost a man who has lost a wife question government on how they are supposed to manage maternal health services? How can an NGO task government on answering questions to do with maternal health services in the country? And they agreed with the government, and they said these are political questions, we can't handle these issues, and they struck out our case. So we appealed to the Supreme Court. The Supreme Court, from their wisdom, the justices observed that there are critical questions on maternal health which touch many lives of Ugandans that have to be determined by the Constitutional Court. There are questions that they are supposed to answer, and they give Ugandans answers, and they give mothers answers because they deserve these answers. So with the decision of the Supreme Court, they directed the Constitutional Court to hear the matter on its merits. So when we went back to the Constitutional Court, the justice of the Constitutional Court looked at the case that we brought to them, and in their wisdom they agreed with us this time, because they looked at what we presented, they looked at how mothers are suffering all over the country, and how we are losing productive women in our country. We are losing our bright mothers, bright sisters, daughters, and the court had to play its role as one of the arms of government. Because we usually engage the executive where they pass laws, we engage them on passing laws, on allocating funds. We even engage Parliament on allocations. We engage Parliament on passing resolutions on so many aspects, including maternal health. But we had a missing link of the judicature, the judiciary. The judiciary was missing in the picture. And then they came in to bridge that role in ensuring that they can check and guide the other arms of government what they're supposed to do in improving maternal health in the country. And the justices were generous enough to guide us on what should be done by the government. One, they talked about the aspect of emergency obstetric care. They said a mother should find obstetric care services in a facility. They should be adequate services of emergency obstetric care. And emergency obstetric care basically means if a woman has an obstruction, do we have a functional theatre where that woman is going to be operated? If we are talking about health center 4, which is a certain level of set to conduct an operation, is it functional? Does it have the required staff who can carry out that operation? Does it have drugs? Does it have oxytocin? Does it have a magnesium sulfate? Does it have whatever is required to save the life of this mother? And if they cannot manage the condition, do we have a clear referral pathway? How does the mother move from that facility if they can't afford to manage the condition? How does she move to maybe Arua Regional Referral Hospital or any other hospital that is equivalent to Arua Regional Referral Hospital? So those are questions that the court tackled and said women should have emergency obstetric care as of right, not as a liability, or not as something that can be either given or not given to them, but as a matter of right. They are supposed to find emergency obstetric care services in facilities. Okay.
Yes, thank you very much, Tereko. And of course, you did say that for somebody to enjoy maternal health services, there should be availability of health services. Yes, looking at Arua, do we have these services?
Arua, like many other regions and many other cities, we still have a challenge of financing of the health sector. You find that according to the Abuja Declaration, we are supposed to allocate, every government in Africa committed, including Uganda, they committed to allocate at least 15% of the national budget to the health sector. And this budget track trickles down to our local, lower local governments, including Arua City. So if we have a limited gap of allocation at the national level, you may find that even the allocations at the low grassroots levels or local government levels also they reduce tremendously. And if you look at the budget trends of health in the past I think 6 or 7 financial years, you find they have been fluctuating between 6 and 8% of the national budget, which is still limited. And we think the justices of the Constitutional Court again said we should have increased financing, we should have sufficient resources for maternal health in the country. So that means that as we are doing our planning as the grassroots, starting from the parish level, if we are doing our planning, if we are having these budget conferences, we must have maternal health prioritized. Do we plan for the commodities? Do we plan for the human resource? Do we plan for the supervision? Do we have functional health management committees that are supposed to assess and then take back comments from the facility to the community, but also feedback from the community to the facility? All those are supposed to be facilitated, and we must see and have allocations from the budgets that we have at the district level, but also at the national level. We must have budgets to ensure that we have a functional system that can be able to guarantee this mother access to better and adequate maternal health care services. Yes.
And what are some of the challenges in accessing maternal health services, especially in Arua or even Uganda at large?
I think we have challenges of equipment. There are those basic equipment like scanners. If a woman has a complication, or if she's pregnant, she comes for antenatal, do we have those scanners to check the progress of the child? Do we have those simple things like pathographs? Do we have them that immediately will use to assess and check on the progress of the mother who has come for delivery? Do we have those, even these simple ones like resuscitation devices for the newborns? Do we have them in our facilities? Do we have delivery beds? Are they functional? You may find so many facilities all over the country. They have these beds, but some of them require just simple repairs that they're not repaired. And you find mothers delivering on the floor, and this is not unique to Arua. It is common all over the country. So if we want to have these mothers deliver safely, we must take a deliberate and concrete steps to ensure that these mothers deliver in a facility which is well equipped, and this we can manage as a country if we decide to prioritize maternal health. And the only way we can be able to prioritize maternal health is ensuring that we can create that safe environment in a facility which is equipped. Because if a mother walks into, say for instance, a health center down in one of the sub-counties we have in Arua City, like a BFA, and then they don't find their delivery bed, do you expect that mother to come back for the next pregnancy to deliver from such a facility? They will, of course, they will start home, and then that will contribute to the increasing numbers of maternal deaths that we have in the country. So I think we need to take deliberate efforts, and I think this requires collaboration between all the key players, not only government, all of government at this level, but we must see everyone, starting from the grassroots people. We must see us coming up with a very strong movement that will contribute to improved facilities and the services of maternal health in our region, but also in our country at large. So it is very important for us to be able to earmark and identify some of those gaps we have in the facilities. If we have a budgeting conference, for instance in Maracha, we are having a budget conference coming up in the coming week. Even in Koboko, it's coming up in the other week. And even in Arua here, the budget conference is about to happen. So how do we get these needs we have in our local facilities, lower health facilities? How do we document them? How do we bring them on table? I think those are some of the critical things that we need to think about as we implement and take forward this judgment. Because if we don't have them in our budget conferences and budget discussions, and they're not part of our budget framework papers, I think it becomes a problem for them to be prioritized. But if we start that bottom-up approach, where we get these views from these people, we get these views from the facility charges, we get these views from the hospital management boards, the health and management committees, I think it can, gradually we are going to have improved services, not only in Arua, but also in other parts of Western, but also at the country level. I think we'll be able to improve. But I think it requires a multi-sectoral approach to addressing such challenges we have in our facilities. Okay,
yes. Before I get to Namaganda, yes, Muhammad, rather Serenko, sorry. Yes, you've taken us through some of the challenges that maternal health is going through. And of course, as said, what are you doing to overcome all these challenges?
I think one, we decided to take on this matter to ensure that we can have guidance of the court on what should be done. And now the task we have is now to work with all key stakeholders to ensure that we implement this important judgment. The judgment is not for Sehat. The judgment is not for Inziku. The judgment is for all of us in West Nile. The judgment is for all of us Ugandans and other people even in the East African region. So what we need to do, one, for us as the Center for Health, Human Rights and Development, we have embarked on training health workers. We have embarked on training local government people. We have embarked on engaging and training policy and decision makers such that they can understand their role. They can appreciate their responsibility. They can appreciate what they are supposed to do to ensure that mothers can enjoy maternal health care services. This is done through trainings. We do radio talk shows. I think this is one of the platforms where we come out and speak and empower people, but also empower duty bearers on what they are supposed to do to improve maternal health care services. But also at a larger point, we engage at Parliament, where we push for increased budget allocations, we push for recruitment of health workers, we push for policies and laws that favor and guarantee access to maternal health care services. But also we sit on different technical working groups at the Ministry of Health, where we discuss policy issues and we contribute to the discussion. But also we are in the communities where we empower also the mothers to appreciate their obligations. I think my sister will ably talk about them. But it's very key to talk about obligations of the mothers. Are mothers prepared to deliver? Do they have information on family planning? Do they have information on what they're supposed to do to prepare for the pregnancy? Are the husbands involved? Like, we look at all those components, just not look at the responsibilities of the duty bearers, but also we also take on the obligations of our mothers and families on how they can avert and contribute the improvement of maternal health indicators in the country. But also we again receive and handle complaints that we receive on maternal health, and we mediate these matters. When we receive these complaints, we encourage and we are building a culture of mediations. When we receive a complaint, say from a mother or in a person in the healthcare system, we usually create room for discussions, because some of these things can be resolved amicably and some of them don't even require money. There are things that can be worked on. For instance, a mother can come and complain, I was slapped by a midwife. You don't need to take a midwife to court, but rather you can have a discussion and see how best to handle such a situation. If you are faced with such a mother who has failed to push, how do you handle her? Do you just slap her, or you find an innovative way of addressing her that concern? So we usually do a lot of sensitization and orientation, but where we fail to negotiate and we think we need to have a system gap, we need to address the system gap, we usually pursue matters, and we have pursued so many matters. So for us, we provide, as an institution, as Center for Health, Human Rights and Development, we have committed to provide free legal services to people of West Nile region, to people of Uganda, and whoever is a Ugandan, and whoever, even if you're not a Ugandan, you're a refugee. We know we have an influx. We have big numbers of refugees in Arua and the greater West Nile region. Those are also some of our clients. If they have a challenge, we are committed to assist everyone to ensure that whenever you are in Uganda, you can ably enjoy the maternal health care services and health care services generally. So we provide these services free of charge, and we don't charge any coin. What we do is to ensure that we work with you to ensure that you can access justice, and we empower you to ensure that next time you can be able to also empower your communities to ensure that they can prepare and they can demand for services, but also they can be responsive and ensure that they can abide by whatever directives are given by the health workers. And we think if we do that, we'll be able to have a better and fruitful maternal health care services and safe motherhood in our country. Thank you.
Yes, that is what Sehud would do to see that maternal services are available to the people. What about other stakeholders? What are their roles in improving maternal health services?
I think the way the structure is, if you look at the regional referral hospital we have in Arua, it is under the Ministry of Health. So the Ministry of Health at that level is supposed to ensure that the facility has a strong supervision structure. And this supervision structure is supposed to ensure that they can be able to supervise all the services. Are the doctors supposed to be on call available? Do we have sufficient commodities?
Is NMS supplying what we request for? Do we have sufficient human resource? Do we handle? Do we able handle the mothers that require cesarean section? Do we have enough delivery beds? Like the entire spectrum of the services. The Ministry of Health at the level are supposed to determine and direct the facility the way they're supposed to handle issues. But also at the facility level, they must be able to identify and forward these concerns to the Ministry of Health. They are supposed to ensure that they can work with the professional bodies in case there is need to have continuous medical education. We have so many advances that have happened all over the globe, all over the globe on maternal health. Do we have our health workers empowered? Are they trained enough to also adapt to these changing technologies when it comes to maternal health care service delivery? So all those are some of the aspects that they are supposed to cater for. But also it is very important for them to ensure that they can be able to allocate funds for maternal health care services. They must ensure that our facilities have functional essential services. For instance, so many facilities in Uganda are suffering with the issue of power shutdowns. They disconnect power on account of non-payment of bills to Meme, and so many of our mothers have lost babies. Some of them have lost lives. Especially, for instance, if a mother is in theater, we are lucky here that we have a lot of solar panels at Parcis. But so many of our facilities down there in our villages, they don't have solar power. They don't have electricity. They don't have even generators. So just imagine the mother in the health center 4 is undergoing an operation and power goes off. How will the doctor see? How do you expect a midwife who is delivering such a mother on torch to able to do the service? So we must ensure that all those other complementary services are availed in the adequate numbers, in adequate quantities, such that the facility will be fully functional. Because even if you have a lot of human resource, you have a functional theater, but you have no water. How are you going to handle the safety of the mothers? How are you going to handle the safety of the doctors? Because we don't have to only look at the safety of the mothers, but also what's the safety of the doctors. If they have no gloves, are they safe? If they have no blades, are they safe? Are they going to pick in their pocket to buy gloves for the mother? I think we need to. They have to look at health in the broader perspective. But also when we come at the local government level, all facilities starting from the general hospitals and below, they are under the mandate and supervision of the local government. So our local governments are empowered on their roles. So as they had, we try as much as possible. And I think I've just had trainings in Koboka and Maracha, where we're training the local governments on what their role is when it comes to health. When you talk about accessibility, what is their role? When you talk about availability of services, what is their role? When you talk about quality, what is their role? And what entails quality? And what they're supposed to do in terms of ensuring they have sufficient resources. So these are some of the things we think we have to take deliberate efforts in ensuring that we can break down. So as I said, we are trying to take an initiative to break down in terms of simplified leaflets and briefs on what does it mean for local government to effectively supervise a health facility. What does it mean for a health facility at a local government level to deliver basic maternal health care services? What is basic maternal health care services? These are things we are trying to work on to ensure that our key stakeholders that we work with in improving maternal health appreciate what they are supposed to. In terms of even legal, what does the patient charter say? What does the constitution say? And if the health workers fail to deliver such services, what happens? Such that when someone neglects a mother and the mother loses life, someone is aware of what is going to happen. Our effort is not to hold the mothers culpable or arrest them for failing to provide the due care, but we need to empower them such that we avoid such scenarios. So in our preventive approach, we focus on ensuring that we empower the health workers, we empower the doctors, we empower the local government players, we empower the people at the Ministry of Health, such that they can be prepared to provide this service, so they don't quote unaware. And we are hesitant to take people to court, but we prioritize having dialogue, mediations, alternative dispute resolutions, such that we can work closely and together to ensure that we can be able to improve maternal health collaboratively, other than looking at people working in silos. Okay.
Yes, thank you very much, Antereko. And we are 16 minutes to 8 p.m. And of course, at 8, we'll have the news coming your way. And for those who have just tuned in, yes, we have guests from Center for Health, Human Rights and Development, SEHUD, and we are talking about maternal health services in Arua. And of course, later on, we shall have your calls on 0776 255086 or 0754-201301. You can also send in your messages on the SMS line. That's 0393-273252. And let me get to Namaganda. Yes, you've been acquired.
Yeah.
Yes. What are the obligations of women in maternal health?
Thank you so much, Harry. When we look at the women, I think they have the obligations. We have looked at the obligations. We have the parliament has its obligation, the government and executive. Everyone has done the obligation. However, we have the obligation of women. Not only women, also men. These we shall classify as our clients. Any client, any woman or man, we are all taking them in one category where they have their obligation. What is their obligation? The obligation, one of them is when the woman thinks of conceiving, there should be consent between the man and the woman. We are going to have this pregnancy. After that consent, they could move again to another step of when one has conceived. Because when you make a plan before, it helps you move ahead well and you make a program for it. When the woman has conceived, there is need for the woman to move to the health center. She shouldn't move alone together with the husband, the fiancé. They should move to the health center and seek medical services, antenatals, all the required antenatals the woman is supposed to attend them. This will help to curb the death at the end. Because the woman has attended antenatal, she's in the record, she has been advised at all times. After that, when they're already in the system of moving, attending antenatal, the woman also has the obligation of attending to the hospital for delivery. Some do attend antenatals, and afterwards they stay at home, fearing for the money, finances. Here we advise the women, go to government hospitals where services are free, as talked about by my colleague, Mr. Nsereko. When the woman has gotten to the time of delivery and she has moved to the health center, depending on which health center, they would always refer her if there is no service at that center. From health center 2 to health center 3, in most cases they go to health center 3 for delivery, and then health center 4, depending on the circumstance of the issue. So when they're at a health center, the women have an obligation to listen to the health worker. They have the skill of advising. We have so many women, their relatives, their husband, refusing to take some of the services. For instance, a woman gave birth to, maybe had 2 children, and now they advise her to take a cesarean section depending on the circumstances, and they do not want to take it up. They delay to make a decision which will affect and cause the maternal death. For us to see how we curb this, all those different advices given at the health center, a woman and her husband are supposed to take it up immediately. He talked about the delays. Every time you delay, some ladies wait at home until it's time. By the time you reach the health center, you may cause a maternal death. We have 16 women dying every day. How do we curb it? We curb it by women doing their obligation together with their husbands. And sometimes their husbands or the relatives who are attending with them, the antenatal, the caregivers. So if a woman has been advised at the right time to take up a cesarean section, we tell the women, please go forth and take that. When you delay, you cause an emergency which may not be at that facility, an emergency which may be required, and at that time, by the time you go, it may cause a maternal death. In this, we advise women to always accept all the advice given by health worker, because they have the skill, and also to attend to a qualified health worker. Some women go to private clinics where they feel the service low, where they'll keep them until it's too late. We advise all women throughout West Nile and the whole country to always go to a qualified health worker. It may be a private health worker, but should be qualified to give that service.
Okay, yes. Thank you very much, Namaganda. And listener, time for us to get to you on 0776 255086 or 0754201301. You can call in for your questions, and of course, we'll have the guests to respond to them. Yes, Namaganda, what are some of the challenges women are likely to face if they don't go for the antenatals? Or even go for delivery at the hospitals?
Sometimes we find very many women lose their lives and their children because sometimes you may not know the position of the child. Some children may be a breech. For you do not go to detect, even attending to the scans as advised. So in most of those cases, it may be very hard for the woman to give birth to such a child. In most cases, we shall leave the mother and a baby.
Okay.
So to reduce all those maternal deaths, we advise all the women, together with their husband and caregivers, to attend to the hospitals immediately.
Let's have somebody here. Radio Parcis.
Hello?
Yes, who are we speaking to?
You're talking to Betty Stephen from UK.
Or Betty Stephen.
Yes.
Yes, so what is your question or comment?
My husband to a woman. Program is okay.
Okay.
Only that is some women, they are not even transparent to the husband. Like when they want to deliver, they take a delay, even to inform the husband. They will know, wait, when the child is about to deliver, then they will tell the parents, this is the complication. So that one will know, the death of the wife will occur. So when the husband, the wife informed the husband earlier, you didn't take the decision very early. But when the woman does not inform the husband earlier, so it will become very hard. You not want possibilities out of very difficult. Sometimes as a husband, you may not have a motorcycle or a vehicle. You may have a bicycle. And when it happens to a late hour, it is very difficult for the husband to tell the such a woman. So sometimes I also blame the woman. Thank you very much.
Okay. Yes, thank you very much. He has a contribution right there. And of course, on the SMS line, somebody is saying this is Apamaku Moses from Uriama, that he wants to know what best a man can do to help the women during delivery to save them from maternal death. Okay, thank you very much. Somebody right here. Radio Parcis.
Yes, hello?
Yes, who are we speaking to?
Yeah, speaking to Tom from Marata.
Yes.
I've been following this program. It is a very good program. But I have two concerns here. The first one is, may I know if by accident a woman delivers of the way before reaching the health center. Is it bad or is it actually punishable or it is just for accident?
Okay.
Two, if a woman delivers at the health center, I do see there are some small services. Is it lawful or it is unlawful? Thanks.
Okay. Okay, thank you very much. That is from Marata. On the SMS line, somebody says, thanks for this wonderful program. May I know how Sehud gets its funds, where it gets its funds from, and how possible will Sehud care for all those... okay? Yes, he's called Robinson from Uriama. Yes, thank you very much, Robinson. And then somebody is saying, Asel Lillian, thanks for your program. What's Sehud in full? Okay? Thank you very much. Radio Parcis.
Hello?
Yes, who are we speaking?
Robert from Leju.
Robert, where are you calling from?
I'm calling from Leju.
Okay, what is your question or comment? Okay, yes, thank you very much. And of course, 6 minutes to 8 p.m. Yes, maybe let's get to respond to some of these questions right in there. But before we get to that, let's have one last person here. Radio Parcis.
Hello.
Yes, who are you speaking to?
This is Victoria from Leju Town Council.
Victoria from Leju, yes.
Yeah, there's an instance where a woman says whenever she goes for antenatal, she's told that she has no baby in the stomach. Yet the baby is playing. How do you help that woman?
Okay, thank you very much. Okay, let's get to the guests to respond to some of the questions raised here. I don't know.
Thank you so much, and we thank the listeners for raising those important questions and the comments. I think I'll start with the last one. The Patient's Charter allows a patient to seek a second opinion. So if a facility A is saying there is no baby and the baby is moving, it's very important to seek an opinion in another facility. And the good thing, we have quite a number of levels. We have a health center 3, health center 4, general hospitals, and then the regional referral. I don't think that any of those levels you can fail to get an opinion. And I think they need to consult those other facilities to get a second opinion. In terms of the funds, we, as civil society, we fundraise for resources and we work in partnerships. That's how we are able to do this work. In terms of mothers that deliver on the way, even if they deliver on the way, it's very important to go to the facility because we lose so many mothers in the first 48 hours of delivery. So we encourage such mothers to go to the facility to seek post-natal care. It is very key because so many mothers are lost between delivery and those 48 hours. So it's very important for them to go to the facility to seek that care because it's part of the broader maternal health care package that they are supposed to receive at the facility. But also importantly, I encourage the facilities and the local government structure in our regions to ensure that they do maternal death audits because it's a requirement that came out of the judgment, but also it is a requirement of law because the current Registration of Persons Act requires if a death happens at a facility, there must be a maternal death audit documented and presented at the office of the Chief Administrative Officer. So it is very important for all the players in the sector, in the region, to ensure that the maternal death audits are prioritized and they are done because they inform decision making. They highlight the causes of death and they inform the priorities, they inform the actions that can be done to avert similar death. So whoever would like to reach us in case they have any challenge, we have a toll-free number which is 0800 31 31 31. They can reach us and have further conversation on some of the issues. Okay.
Yes, thank you very much, Ansereko. And maybe Namagana can get to respond to this. Somebody asked, what best can a man do to help the women during delivery to save them from maternal death?
Okay, thank you, Harry. We advise men to attend antenatals. If you've been attending antenatals with your wife, it's very hard for you to miss that date because you'll be told that you're dead. You could even advise her on that regard. The women would also feel your support in regard to this. Sometimes women feel abandoned by their husbands or fiancés.
Okay, yes, thank you very much. Maybe let's have your last word as we sign out. Yes, let's begin with Namaganda.
I want to appreciate all our listeners. Thank you for listening in to Parcis FM, and also advise the mothers and their husbands to always attend hospital because we have a marxism in law which says delay defeats equity. When you delay at home, you're going to lose your own life, you're going to lose your daughter, you're going to lose that mother, and the nation shall lose that valuable person. Thank you so much.
Thank you very much. And let's get to Edith. Yes, your last word.
Thank you very much. Before I say my last word, one of the callers asked what is SEHUD in full. And SEHUD is Center for Health, Human Rights and Development. And my last word would be about men getting involved in the process of child delivery. It's not only an obligation to go for an HIV test when your woman is pregnant and you stop there. From the time that she conceives, you need to be by her side, not to wait for her to open up to you when is the delivery date. You ought to know that because you're always with her. This is a pregnancy for the two of you, not only for the woman. So that will help us to fight some of these issues because some women are not economically empowered, so they need their men to help them in such issues. So we need the men to be involved right from